Hey guys, Keith and Rachel, and we're here to share a little about the seminar we went to last weekend. We are super pumped about the things that we took away from it, and I will let Keith take it from here.
Yeah, so the course we went to is called DNS. It stands for Dynamic Neuromuscular Stabilization. Yeah, I know it's a mouthful, but it's incredibly powerful. So a couple things we wanted to talk about. There's actually three things, and the first one is, what is DNS to us? And you want to go for it?
Well, DNS to me was something that we grew up doing and didn't realize we were doing. So I have had, aches and pains throughout my life, and DNS was the first approach that showed me why these things might have been happening. So I think that it was just, an aha moment, and I can't help but see it everywhere I look now. It's pretty amazing that someone figured this out.
It's kind of frustrating too, because at times you see it and you're trying to turn it off and you're like, yeah, nope, can't do it, sorry. So DNS, the instructor of the course, his name is Robert Lardner. He's out of Chicago, brilliant mind. He had a great saying for it, was DNS is much like Google Maps, and that it gives you this blueprint, this roadmap to better understand human movement. And that's really powerful. And going into the next thing is how do we integrate this powerful understanding of movement, but being able to get people to this ideal, or this quotation marks, this ideal patterning to where they're out of pain and improved performance. So how do you integrate DNS with your approach?
I think DNS can be a multiple faceted approach, because you can use it as a way to assess person, or you can use it as a way to treat person. You can use it for everything. And I think that it's awesome to be able to have some guidelines, but it's not a strict, step-by-step approach. So you get to have some freedom with it as well. You can have a patient get into a position and maybe they aren't, they're feeling tightness in their shoulder, or their mid-back just feels locked up. We can then go in with our chiropractic tool belt and address that specific issue, and then go back and retest it in that same position, and hopefully they're doing better and go from there.
Yeah, she really hit it on the head for me when she said retest. It's all about, you do an assessment on the first visit, and you're trying to figure out what's going on with the person, what their flaws, maybe movement-wise, are, and you test it. You try to integrate something, and the DNS gives you this complex understanding of it, and you do your manipulation, you do your soft tissue, or you put them in the patterning for DNS, and then you retest and see how it moves after that. It's really test and then retest. So it kind of goes into the next thing is, how have we already utilized some of the tips we learned from the seminar into our patients already?
Something that I think both of our instructors really emphasized this weekend was getting the patient to feel what they're doing. So maybe Keith or I can get you in a position and we can tell you how good it looks and how good you're doing, but if you can't feel it, then you're not going to be able to replicate it. And one time in the office doesn't substitute for being able to do it, even daily, if you're able to do that on your own. So I think that that's something that I took away, was making sure that my patient was able to feel what was good, maybe what they needed to pay attention to in case, something wasn't feeling right. So I think that there's simple cues that we picked up, or simple cues that I used to use and now I've tweaked. Yes. And even just the first week using them, I feel like I have patient understanding, and they can just be aware of their body position.
Yeah, it's all about self-awareness. And I mean, you've heard like Gary Vee talk about that, so much self-awareness, but that you can even talk about that in feeling where your body's at in space. A great little mini case that I had last week, I had a good CrossFit athlete come in. She's hypermobile, so she has movement all over, and we put her in a DNS position and just worked on her getting to stabilize and breathe in certain areas that that was decreasing her performance and causing some pain. And I could see the pattern, her breathing. It was great. It was awesome. And I asked her, I was like, oh, I'm so excited. I was like, how does it feel? She's like, I don't feel a darn thing. And you're just like, great, okay. So then you go into some motion palpation, and you feel where the restricted joints are. We adjusted her. We put her back in that position, and immediately she felt it. So it was incredible. It's like marrying the two, the understanding, the deeper understanding of DNS, and being able to palpate and feel the joint restrictions, and then integrate those together. And it was just like lights on. It was awesome. She could feel it, and it was a great take home for her to do too. Is okay. Now I want you to go feel this position out at home, do this exercise, and come back and let us know how it feels. We'll modify it if need to. So it's marrying this great roadmap and having the right tools for the right job and coming together. So
yeah, that approach, going to these seminars is a nice refresher to still be a student almost. You want to continue to learn because that's how you get better. So I think that weekends like these remind us, there's things out there that we don't know. So I think that also is something that we love for our patients.
Oh, yeah.
We love to be able to, even if it was something we weren't quite getting the first time, now we have just that much more knowledge to be able to approach that situation. So everyone benefits.
We hear that all the time too. It's like, I have never heard that before, or makes perfect sense. Finally someone can explain that to us. And that's like our why is being able to help people and understand their body and what's going on with them more. So that's ultimately it, is why we got into this profession. And for many of you, it's the same way that might be watching this. So, see anyone? Oh, sweet. We had a couple people jump in. Hi, Don. Hi, Tyler. Thanks for joining. Appreciate it. We're actually getting ready to check out. So, if you guys have any questions, we'll kind of ramble here for a second. If not a problem. I appreciate all of you guys watching us and chiming in. It's great. It's been awesome. So, thank you guys so much, and maybe we'll do one here in a couple weeks. So let us know. Thanks, guys.